Next is about siravarnavibhakti shariram vyakhyasayamahe sovacha bhagavan tarihi. About the Sira Varna Vibhakti, the differentiation of the Sira and the Varna. Now, the word Sira is again quite often misunderstood and then misinterpreted. Many times, most of the previous textbook, so-called Ayurvedic textbooks, they claim that Siras are veins and Dhamanis are arteries and so on. Now, we look at the description as mentioned in Sushruta. The Sushruta has mentioned about the Sira as Sapta Sira Shatani Bhavanti. There are 700 Siras and their function is Yabhi Idam Shariram Aravaiva Jalaharinibihi Ketaraiva Kulyabihi Upasnihyate Anugrishyate Ja Akunchana Prasaranadibihi Visheshaihi Dhumapatra Sevananiva Tasam Pratanaha Tasam Nabihi Mulam Tasascha Prasaranti Urdhum Adharati.
Screen is not visible, sir.
Huh?
Screen is not visible.
Screen is not visible. Is the screen visible now?
Yes, sir. Yes, sir. Yes, sir.
Okay, fine. Now, the function of the siras are the compared to aramaiva jalaharanibihi, like a channel which gives water nourishment to the garden, or another is kulyabhi kedareva kulyabhi, like a water channel filling into the pond. Now, this is a very beautiful description of the functions of the cardiovascular system. One group of vessels which provide the nourishment to the periphery from the central area, from the pond, that's from the heart to the periphery, arterial structures, and then the vessels which bring the blood from the periphery to the central zone, collecting center, the heart as such, the venous system. So the functions of arterial system and the venous system both are mentioned in the siras. Siras are not simply veins of the arteries, they represent both these functions like arterial as well as the venous functions. Now in the current anatomy we make out that difference between an artery and a vein based upon the thickness of the vessels and then maybe the direction of the flow, but even that direction of the flow is not very accurate when you give the nomenclature. That's a different issue, but we consider them based upon the thickness of the vessels and the structure of the vessel. Now Sushruta has included both these into a single system, so he has looked at the cardiovascular system and that idea of a cardiovascular system being a closed system where the blood will flow in and flow out from a central zone is the important issue. And then these functions are again upasnihyate anukrishyate. There are two modes of function, upasnehana and anugrahana. Upasnehana is where there is no direct contact but there is some flow across a membrane, the semi-permeable membrane, that osmosis, it provides nourishment through the osmosis. We use the word osmosis. Then anugrahana is maintenance of the look or the shape as such. Anugrahana is maintenance of the shape. That's the hydrostatic pressure. So maintenance of the total shape of the body, shape of the organ by having that interstitial fluid and maintenance of the sufficient hydrostatic pressure at the area. And then osmosis, through the osmosis the nourishment is carried through. So exactly the same functions of the cardiovascular system are described. And this is done by akunchana prasarana divi visheshaihi. This function is achieved by a regular contraction and dilatation functions. Now Sushruta has not mentioned whether it is the heart which pumps or some other structure which pumps, but there is a continuous activity of a pulsation, and that pulsatile activity helps in the movement of the blood into the periphery, and their distribution is Dhumapatra Sevani Namni Vatasam Pradana. They are distributed into a fine network, tapering effect. One thicker branch becomes thinner and so on. So it goes to the periphery where it becomes invisible, and this kind of a distribution is seen in the leaves. When you look at a leaf, the shape of the vessels, which we call as the xylem and the phloem of the leaves there are the vascular structures. Also veins, also the names also are of the veins. They have a similar presentation, like where they go on tapering. Now, the only other difference is Sushila considers Asam Nabhi Moolam Tadasha Prasanti Urdhum Adastiriakta. Sushila considers Nabhi as the Moola, whereas now when we say the cardiovascular system, we identify the heart as the center. So we will come to that part, like whether Nabhi is the Moola or the heart has to be considered. Now, compared to what Sushila has said in 5000 years back, if you look at the Western concepts of the blood circulation, it's a very interesting issue. The concept of the blood circulation in the Western system was totally different in the historical facts. In the olden history of that Western medicine, it was considered that the cardiovascular system is a open system. It's not a closed system, and the veins contain the blood which is having a blue color, and white arteries contain the white color blood, and food is taken from the intestines by the portal veins and delivered to the liver, and from there it gets distributed. So in the Western science also, the idea of the circulation at that time was the food which gets distributed to the periphery was given more importance by this was Aristotle, who was considered to be one of the major these old scientists of the Western science. But the closed system was not known. It was considered that from the nature, the air and the other substances from the nature, energy is taken into the heart and then it's pumped out to the periphery along with the food. Now, Galen demonstrated further that it's not the air but the blood itself, and he considered again the arterial system where the blood would be, it's not air, it's only the blood which gets circulated in both these groups of the vessels. This is done by Galen. And even then, the idea of a closed system, that the blood from the artery goes into the veins, that was not known. And it was the credit of inventing the closed cardiovascular system goes to William Harvey. William Harvey in 1627. The whole idea of a closed vascular system where the blood from the heart arteries gets into the veins and the same blood is circulated, that kind of a concept came in 1627. That's only around 500 years, roughly around 500 years, or maybe slightly more than that. The idea of the closed vascular system was invented, and all the credit goes to William Harvey, who proved this fact. And he was considered to be, it was considered to be against the principles of the church as such, and he was rather, at times he was punished, and then of course at the end he was rewarded also. Anyway, that concept of the closed vascular system came into the practice in Western system only about 500 years back, whereas 5000 years ago, Sushruta has clearly demonstrated this function, and the whole functions of that, like the nourishment and the pulsatile activity, is clearly described. Then the controversy is about whether the Nabhi has to be considered as the Moola or whether the heart has to be considered as the origin. Now, Sushruta has clearly described Yavatistu Sirakaye Sambhavanti Shariranam Nabhyam Sarvaha Nibaddhaha Taha Pratyananti Samantadaha Nabhistaha Praninam Pranaha Prana Nabhir Vipashita Sirabhi Avata Nabhi Chakra Nabhiriva Arakaihi. Now, if you look at the circulatory system, cardiovascular system, it's not that it's a single circle. You have, when you look at the heart and the vessels, from the heart the vessels go in and then the blood goes into the arteries and then go to the veins, it comes back. If you look at the pulmonary circulation, again it is the same thing. Pulmonary circulation, the heart blood will be circulated. There is a circulation of the portal system. There is a circulation of the renal system. The portal system, from the abdomen, the nourishment is taken. Renal system is excretion. So, and then of course you have the periphery, the somatic circulation, where the circulation reaches to the periphery. Now, a circulatory system is not single. You have primarily, most importantly, three circulations, major three circulations: pulmonary circulatory bed, portal circulatory bed, renal circulatory bed, and of course the cardiovascular, the pumping. Now, if you look at the hydrostatic pressure, the pumping activity, heart is the center. But if you look at the nourishment function of the blood, then definitely it's the abdominal vessels. Now, solar plexus or the nabhi, which is considered as one of the most important chakra in the yoga practice, also nabhi chakra, and their description of the nabhi chakra also is well defined in case of the yoga shastra, where it's considered to be pranasthana because the whole nourishment of the body, the food which is consumed and food gets into the system is through the abdomen, and hence the abdominal vessels and abdominal structures are given more importance considering the function of the nourishment of the body. Now, this is just a looking, this is a perceptual difference. If you consider the movement of the blood, then definitely as the heart has to be considered the more important part. But if you look at the nourishment, it is the portal system, the abdominal vessels. If you consider the oxygenation, it should be the lungs, which is the base of that. Or if you consider the excretory functions of the blood, then the renal system has to be considered. Now, this kind of a perception is just a perceptual difference. So, the idea these blood vessels are limited to cardiovascular, it's only the heart and the vessel also is not correct. At the same time, if you consider the other area also as center, that it's not giving that the whole structure is, whole function is dependent upon a single area. Every component of the body, every structure of the body has a relevance. But to make you understand or to comprehend, you need to start from one point. Like when you draw a circle, the circle doesn't have any starting point. But if you have to draw a circle, you have to have a starting point. Same way, if you have to describe cardiovascular system, the circulatory the structures, there has to be a starting point. So somebody may start with the heart, somebody may start with the portal circulation, somebody may start with the pulmonary. So every aspect is absolutely true. So when Sushruta has given Nabhi as the moola of the cardiovascular structures, the circulatory system, it has to be taken in as the nourishment function of the vascular system as the most important, and then the Nabhi becomes the moola. And throughout the whole concept of the yoga and the practices, the Nabhi is given significant importance. Now, tasam moola siraha chatvarimshat, tasam vatavahinyo dasha, pittavahinyo dasha, kapavahinyo dasha, dasha cha raktavahinyah, tasam tu वातवाहिनीनां वातस्थानगतानां पञ्चसप्तशतं भवति तावत्येव पित्तवाहिन्यः पित्तस्थाने कफवाहिन्यश्च कफस्थाने रक्तवाहिन्यश्च यकृत्प्लीनोः एवम् एतानि सप्तशिराशतानि भवन्ति. Now the divisions of these are, according to Sushruta, Moolasiraha Chatvarimshat. There are 40 major vessels, and these major vessels again are categorized into Vatavahini, Pittavahini, Kapavahini and the Raktavahini based upon the functions. Now, whether it is a function of the vessel or whether it is a function of the organ which it reaches, like. See, when you say a renal vessel, renal artery, the artery is otherwise same, but because it reaches to the kidney does the function of the excretion. Now, the difference is now we use the word renal artery because it has the relation to the kidney and the functions of the kidney are achieved. A hepatic artery, it reaches to the liver and it produces the functions of the liver. Now when Sushruta says Vatavahini vessels or Pittavahini vessels, it's again on the same principle like the vessels which reach to an organ and then they produce a function. Now, the only difference now is we now consider the importance of the organ than the function of the organ. See, if you consider the hepatic vessel artery as a artery which produces the metabolism, which helps the metabolism, we call it metabolic artery, maybe Pittavahini. And the arteries are vessels which reach to the nervous system or facilitate the nervous functions and achieve the functions of the nervous system, they Vatavahini and so on. So we need to look at the structures not as the blood carries the Vata or blood carries the Pitta. So if that is the concept, so the literary meaning of the word is Vatavahini, it carries the Vata. That's not really the correct one. Instead, it produces facilitates the functions of the Vata, and some of the vessels facilitate the functions of pitta, and some of the vessels facilitate the functions of the kapha, and some of the vessels, they are the structures which facilitate the functions of the blood, and those vessels which facilitate the functions of the blood are reaching to the yakrita and pliha, the portal circulations, and pittasthane kapavahini Pittavahini dhamanis are the mesenteric vessels which produce the which facilitates the nourishment and the digestion. Vatasthana, that's it's almost throughout the body that the functions of the sensory and the motor activity are facilitated. So you need to look at that. But the question comes in about the counting, like the 42 vessels and 10 of these Vatavahi, 10 of the Pittavaha. It may not be possible to make out with the current perception as such. Maybe if you do not have this kind of a current perception of naming the vessels based upon the structures which they each them or their shapes and so on, then it may be possible to count the number, but it's not really practicable to count the number, and it may not be possible to point out like which is the Vatavahi vessel, which is the Pittavahi vessel as a. But looking at the description, to a certain extent, we can make out which are these vessels. Vatavahinyah siraha ekasmin sakni panchavimshatihi etena itara sakti bahucha vyakhyata. Now, in one limb there are 25 vessels. Now, again, to count these numbers, 25, practically not possible with the current discipline of nomenclature. But if you look at the functions of the thigh and arm are to do the motor functions. So, because the vessels which facilitate the motor and sensory functions of the limbs, which will help in movement, they are called as Vatavahi. Similarly, Visheshadastu Kosya Chatustrinshada, 34 in the abdomen, and Tasam Buddha-Medhashitaha, Stroniam, Astau, Dve Parshayoho. In the Buddha and the Metra, in the pelvic area, there are 8 of them, and on the two sides, paraspinal vessel structures, there are Dve, 2 each. Shataprishtha, over the back, there are 6. Tavatya Udare, in the anterior abdominal wall, the same 6 numbers are there. Dashavakshashu, 10 over the thoracic cage. Now again, question of naming them or identifying them with the current nomenclature may not be possible, but they do the functions of the Pittavaha or these Vatavaha functions, like facilitating the movement as such. Similarly, Vatavahineha एकचत्वारिंशत् जतृण ऊर्ध्वं तासां चतुर्दशग्रीवायां कर्णयोः चतस्रः नाम जिह्वायां षट् नासिकायाम् अष्टौ नेत्रयोः एवमेतत् 75% वातवाहिनीनां शिराणां व्याख्यातं भवति. These are the 75 of the Vatavaha siras. Now, as I told you, these vessels which facilitate the function of the nerves, like the movement or perception of the sensations, and those vessels which are very close to the nerves, in the neurovascular bundles where the nerves and vessels are close together, they may be considered as Vatavaha siraha. Visheshas, so Esha eva vibhaga sheshana. Similarly, you have to identify Pitta and Kapha vessels, or Pitta Baha and Kapha Baha vessels. Visheshas, so Pitta Bhanyaha Netrayoho Dasha. The Pittavaha are into the eyes. There are 10 of the branches which carry the Pitta. Now, Pitta functions in the eye are the functions of chemical activity in the optic disc, which facilitate the perception of the light. They are Karnayoh Dve, similar to the biochemical activities in the ears, which facilitate the perception of sound. Evam Mrattavaha Kapavahashcha, Evam Metani Sapta Sirashtan Bhavanti. Similarly, Rattavaha and Kapavaha functions have to be carried. Now, Sushruta gives again further clarification about these Vatavaha, Pittavaha, Kapavaha, Siras. Kriyadam apratigatam amoham buddhikarmanam karoti anyan gudaschapi swaha siraha pavanascharan yadadu kupito vayuhu swaha siraha prasipadyate tadasya vivudha rogaha jayante vatasambhavaha. Now, those vessels which facilitate the functions of the Vata, they are considered as a Vatavaha. And whenever those vessels are affected, there will be a Vata Vyadhi Lakshanas are produced. Like a vessel which reaches to the brain, if it gets affected, It can produce the neurological deficits which we may consider as Vatavayadi, or a vessel which reaches to the periphery of the blood muscles, and then the muscle movement is affected, which again is a Vatavayadi. Then you consider this as the Vatavayadi, or we attribute this to the Vatavaha function of the Siravarna. Similarly, Bhratishnatam, Annaruchim, Agnidiptim, Arogatam, संसर्पत स्वाह शिराः पित्तं कुर्यात् च अन्यान् गुणानपि यदा प्रकुपितं पित्तं सेवते सोवः शिराः तदा अस्य विविधाः रोगाः जायन्ते पित्तसम्भवाः. The pittaja vyadhi, pitta vessels, they maintain the appearance of the surface of the body, and they produce that perception of the taste sensation properly and digestion and so on. Now, the bhrataka pitta over the skin, like if there is a this ischemic pathology, the skin becomes lusterless. That is sign of the pitta being affected. Now, we may not identify which of the vessel results in the loss of luster, which of the vessel results in the atrophy of the muscles and loss of movements. In a vascular pathology, over the periphery, you may have a sign of loss of luster of the skin and loss of this atrophy of the muscles. Atrophy of the muscle is Vataja or Vatavyadhi, and that loss of luster is Pitta. In the current physiological perception, we may not make out the difference of the vessels which have produced these structures. But Sushruta had that idea, perception, like certain specific vessels which when they are affected, they will produce the impairment of the appearance of the surface of the body. Some of the vessels which may produce the atrophy of the muscles, and hence they are named as Vatavaha or Pittavaha. Like, so this has to be perceived, like that's how it has to be perceived. Similarly, Sneha Angeshu Sandhinam, Sayyam Balam Udirnata, Karoti Anyan Gunaschapi Balasa Swasirashcharanam. Kapha functions are attributed to the Kapha Vasira. Yada to Kupitam Sleshma Swasira Pratipatile, Tada Sevidha Rogha Jayante Sleshman Sambhavaha. The Raktavaha Dhatunam Purnam Varnam Sparshajnanam Asamshem Swaha Siraha Sancharat Raktam Kuryacha Nyan Gudanapi Yada Kupitam Raktam Sevate Swabaha Siraha Tada Sevidha Rogaha Jayante Raktasambhavaha. Maintenance of the hydrostatic pressure, the blood pressure, that's the Dhatunam Puranam Purana vessels being filled up, and because there is a hydrostatic pressure, the nourishment can be carried from one point to the other, and that is the main function of the Rakta Sambhava, Raktaja Siras. So, a patient having hypertension or hypotension has to be considered as a abnormality of Raktavaha Siras. And it also can produce the complications like Sparshajnanam, Asamshem, and so on, and all other Raktaja Vyadhis also can be produced. That's how it has to be perceived. Now, there is nothing like a Kevala Vatavaha Sira or Pittavaha Sira or Kapavaha Sira. That's what Sushruta has mentioned. Nahi vatam sira kashchid na pittam kevalam tata shleshmanam va bhantyete atah sarvaha sintaha. So this fact has to be kept in mind. It's not possible or it's not justified if you identify one vessel as Vatavaha or one vessel as Pittavaha. We have to consider this in the perception of the functions of the vessels, and then only this concept has to be understood. So it's not to confuse, and rather we may feel like confused because we are accustomed to the present method of nomenclature where a anatomical relationship is given more importance, the structural relationship is given more importance, not the function. Whereas from Ayurvedic point of view, we have to give more importance to the functions, and hence a single vessel would have the component of Vata, Pitta, Kapha as such, and based upon the impairment of the results or impairment of the results seen in a structure, like when a vascular complication has occurred, now if at all it has to be attributed to the peripheral ischemic disorder, when this ischemia has resulted, the consequence of the ischemia, the first of the consequence would be producing the pain, and that pain felt, we consider this as the Vata Prabhu. The next of the complication which can occur could be that the local area may become infected, the metabolic activity of the tissue would be affected, accumulation of the intermediary metabolic products would occur. This is the vitiation of the Pitta. And when there is a significant atrophy and maybe absolute heaviness, loss of sensation which occurs in the later stages, that's how the Kapha would occur. So, a ischemic pathology, we now consider this as a sequential progression of the same disease. Whereas from ionic perception, this has to be considered a stage where Vata is involved or Pitta is involved and Kapha is involved as such. So that's all the difference in the perception, and this difference in the perception has certain relevance in the management too. That's also important. Now, anyway, more of this we will discuss when we discuss the treatment, the therapy, chikitsa there. प्रदुष्टानां हि दोषाणां गुच्छितानां तथावतां ध्रुवम् उन्मार्गगमनम् अतः सर्ववः स्मृताः. The same fact, like because the doshas are present throughout, they can produce they produce the vitiation of doshas, and their movement also, the doshas also, direction of the movement of the doshas also would be affected. There could be a retrogressive movement of the doshas, and hence they are considered sarvavaha. Further, tatra arunaha vatavaha puriyante vayuna siraha pitta dushnascha nilascha shitaha gauriyasthiraha krapata asar guhat rohinyah siraha natyusna shitalaha. The appearance of the vessels may slightly change because of the prominence, or the color of the blood also may change depending upon the functions. Arunaha vatavaha, when the vatavaha sira, they would have a aruna colored, more red colored blood, and pitta dushnascha, the blood in the pitta vahasira, they would be more warm and nila. Shita gaurya, the kapha vahasiras, they would have maybe somewhat colder temperature, maybe lesser. Now, though we now collect the blood sample from any vein and any of the arteries and then study, the idea, like the constitution of the blood would be uniform. See, whenever we collect the blood sample, we may collect the blood sample from any vessel from anywhere, and we consider this as a sign of pathology. But practically, if we look at it accurately, the constitution of the blood is not uniform throughout the body. It depends upon the metabolic activity of the particular structure, and of course also the organ to which it reaches. Like the portal vessels, the portal blood would have more of this protein and fat which is absorbed from the gastrointestinal tract, and the pulmonary vessel would have more of oxygen concentration or lesser oxygen concentration depending upon the location. Even in the periphery, if you look at the metabolic activity of the muscles, if you collect the sample of an area where the muscle is contracted more or continuously, and from another area where the muscle is relaxed, there will be at least some identifiable difference from the biochemical point of view. But these are not really documented properly, or these are not really used practically in the clinical field. This fact is known, but these are not used in the practical clinical field. But in the practical clinical field, we know now about the difference between the arterial blood and the venous blood. Though it's not in terms of what Sushila has said as the visible color changes. Of course, with the arterial and venous blood, there is some visible color change too. But whereas in the other areas, that kind of a color change is not really mentioned. But biochemically, we can definitely make out the difference. And this is about the difference between the arterial blood, where there is a huge differences, facts of huge differences as such. Similarly, the pulmonary artery wedge pressure, pulmonary arteries, and the peripheral vessels, there is a significant difference. These differences are often used in the clinical practice, whereas the other facts are not really used. But Sushila mentions about that difference. So when Sushila says about the difference in the color of the blood, it has to be considered as the biochemical differences which are at the different areas of the body, and that's absolutely true, though that kind of a difference is not practically made out in the routine clinical practice. Now that's about the description of the siravarna as such. The next is about the siravyadha, the treatment of the majority of the vessels in majority of the diseases in those days were done by the venipuncture, and Sushila gives again a detailed description of the siras which can be punctured and which cannot be punctured. At this stage, in this chapter, Sushila gives a list of avyadhya siras which should not be punctured. Again, in the beginning itself, I clarified, practically to locate these vessels, like which were the real vessels considered by Sushila as avyadhya, would be very difficult, very rather impossible. And in those who practice Raktamokshana quite frequently, I do not practice Raktamokshana quite frequently, but those who do not practice Raktamokshana frequently also, they also are not able to point out which are these vessels. So at the present, we just casually look at these locations and maybe trying to locate these vessels to a certain extent, but this is definitely not objective. So the description, whatever we describe now, would be very much limited to only the theoretical facts. अतः ऊर्ध्वं प्रवक्ष्यामि न विध्येद्याः शिराः पृषक् वैकल्यं मरणं चापि व्यथात् तासां ध्रुवं भवेत् शिराशतानि चत्वारि विद्यात् शाखासु बुद्धिमानं षट्त्रिंच शतं कोष्ठे चतुष्षष्ठं च मूर्धनि शाखासु षोडशशिराः कोष्ठे द्वात्रिंशदेव च पञ्चाशत् जतुनश्च ऊर्ध्वम् अव्यध्याः परिकीर्तिताः 400 siras in the shakhas and 63 shiras in the kosta and 64 siras in the murdha, in the ear, head and neck, and 16 in the each of the limb, that's 64 together over all the limbs, and 32 in the abdomen, and Panchashat Jatrunascha Urdhva, 50 over the Jatru Urdhva. These are considered as avidya. Now, if you can count them together, it becomes more than 700. See, Sapta Sirashata, Sushruta has mentioned 700 siras. But if you put all them together, count them together, including 64 in the periphery, the total count becomes more than 700. So that's an area, grey area, where, which we cannot justify. Anyway, the in the description, further description is तत्र शिराशतम् एकस्मिन् सक्नि भवति तासां जालधरा तु एका तिस्रश्च आभ्यन्तराः तत्र ऊर्ध्वसंज्ञे द्वे एण्ड् लोहिताक्षसंज्ञान्ते एका तास्तु अव्यध्याः एतेन इतरसत्यबाहु च व्याख्यातौ एवम् अशस्त्रकृत्याः षोडशशाखासु in the each of the limb there are two groups of the vessels, the deep and superficial. Sushruta names that superficial vascular structures as Jaladhara and the deeper structures are Urvi and Lohitaksha. So I would not say commit to that, but possibly it's about the superficial venous system, which is the Jaladhara, and the deeper arterial and venous system, the deep veins and the arterial system, femoral vessels as such, as the Lohitaksha, and they are again counted based upon the branches and the plexus structures, the vascular plexus structures, the collateral structures as such. And Sushruta might have noted these as the 16 in number. Now to identify which are these 16, practically not possible, but at least we can make out that the Jaladhara, the superficial, and the deeper vessels of the Urvi and Lohitaksha, which also are named in the Marma Prakarana. Urvi and Lohitaksha also are named as Marmas. And these and the location of the Urvi and the Lohitaksha in the Marma Prakarana is very pointed, like where it is 2 angulas or 3 angulas, whereas when it comes to the question of description of the Avyadya Sira, it's not about that Marma, but it's about the total vessel which is identified. Similarly, in the Shroni, Dvatrimshat Shronyam, 32 vessels in the Shroni, the pelvic cavity, Tresham Tasam Astau Ashastra Dve Vitapayoho, in the Vitapa, that's in the inguinal area, 2 are them. Katika Taruna in the posterior surface, Katika Taruna again related to the Marma. There again, we have to consider this part like Katika Taruna Marma and Katika Taruna Avyadhisara, whether they are the same or not. From my point of view, they are different. Or similarly, Vitapa Marma and the Avyadhisara at the Vitapa, they have to be considered as 2 different issues. Astau ekekasmin parshe tasam ekekam urdhvagam pariharet. The urdhvaga vessels, in the sense, those vessels which carry the blood from the pelvic area to the periphery, the superior side, maybe the venous system, they are to be avoided. Parsha Dve. Similarly, on the Parsha Sandhi there are 2. Chasastro Vimshatisha Pristhe, in the Pristha over the back, the 24 are identified. Again, practically to locate them would be difficult, but they are again further categorized. Tasa Murdhogambinyam Dve Pariharet, Brihati Sire, that Brihati Siras, the maybe the aorta and the inferior vena cava, possibly, maybe. Tavatyeva Udare, Tasam Medropari, Romaraji Mubheto Dvete Pariharet. Then the inferior epigastric vessels, which would be in the anterior abdominal wall, they have to be avoided, and the paraspinal vessels also have to be avoided. That's most possibly the structures like. Similarly, in the thorax area, Chatvarimshatokshasi, 24 are mentioned by Sushruta. To identify this 24 and count the 24 is not possible, but most possibly the bigger vessels which are considered by Sushruta are Hridaya Dve, the aorta and the inferior, this vena cava, the major veins. They are the major two structures possibly. Then Sanamule, Stanarohita, Apalapa, Stambheshu, Ubheta, Astau. Stanamula, Stanarohita, and Apalapa, which also are considered in the Marma. The vessels which are related to those, the over the anterior thoracic cage and the posterior thoracic cage, the thoracic vessels, they are considered as a Ashastakrityaha. Similarly, Prishta Udara the 30 of Dvatrimshat, total 32 of these being the Prishta Udara Uras. Then over the skull and the above the neck and the head, चतुष्षष्ठं शिरासतं यत्र ऊर्ध्वं भवति तत्र षट्पञ्चाशत् शिरोधरायां. In the Shirodhara area there are षट्पञ्चाशत् 56. Now again to identify this practically would not be possible, so I will not go into that part, but I will be just giving you some idea about how the structures are located. Like the vessels, you have the vessels which are moving on the anterior compartment and then over the surface, and then the circle of Willis in the brain, the base of the brain, which forms a confluence and gives the blood flow in all directions uniformly. Similarly, venous drainage, which again accumulates in the cavernous sinus and drains out. Now, how the sensitivity of these would be difficult to make out. And about the marma, we have already discussed in the marma chapter. Now, whether the marma there and the vessels here or the siras here mentioned here are the same or not, again the same question mark. I would consider these as two different issues. Anyway, the whatever Sushruta has mentioned is tasam astau chatasascha marma samnyaha. They are named as marma. They are parihare. They have to be avoided. द्वे क्रिकाटकयोः द्वे विधुरयोः एवं ग्रीवायां षोडश अव्यथ्याः हनोः उभयतो अष्टौ तासां सन्धि धमन्यौ द्वे द्वे परिहरेत. Sandhi Dhamani is also to be mentioned. Now again, whether Dhamani, what is Dhamani, that part we will discuss when we go into the Dhamani Vyakarana in the next coming chapters. Like then Shatrimshat Jihvaya, 36 in the tongue. In the tongue, as per the nominated vessels, we do not have 36 vessels counted. But there is no question of now whatever we now consider in the anatomy and counting the vessels is not definitely not objective, not end of it. There are still more vessels which are not really named, and we identify and name the vessels till to a certain extent where they are visible. Beyond that, the finer branches, they are not named. So there is nothing like you cannot say that there are no 36 vessels in the tongue. No, it's not that. There are vessels, they are not named in the current anatomy. Similarly, elsewhere too, it is the same thing which is to be considered. Then some other Shodasha Asastrakrityaha, the 16 of them are Asastrakritya. Rasavhe dve, Vagvahe dve, so and dvihi dvadasha nasayam, 12 in the nasa, nose area, tasam aupanasikaha, no aupanasikaha chatasraha parihareta. The vessels which are close to the nose, 4 of them have to be avoided. Tasam eva chataluni ekam mridau uddeshe. In the soft talu, the soft palate, there are again 2 ekam, 1 vessel. Astatrimshad uvayoh netrayoh, 38 in both the eyes as such. Tasam ekekam apangayoh parihareta. In the apanga, you have to avoid the vessels. Karnayoh dasha. तासां शब्दवाहिनीं एकैकां परिहरेत्. तासां नेत्रगतास्तु ललाटे षष्टिः तासां केशान्ता अनुगतश्चतस्रः आवर्तयोः एकैका स्थपन्यां च एका परिहर्तव्या. शङ्खयोः 10 तासां शङ्खसन्निगताम् एकैकां परिहरेत्. 12 मूर्ध्नि तासां क्षेपयोः 2 परिहरेत्. सीमन्तेषु एकैकासु एकाम् अधिपतौ इति. एवम् अशस्त्रकृत्याः 50 जत्रुण ऊर्ध्वम् इति. Now as far as the Siramokshana practice now, I don't know, I have not come across anyone practicing the Siramokshana in these areas, in these specific areas like skull, near the eyes or so on. So most of the times those who practice the Vyadha now, they are limiting to the cubital veins. That's how it's seen. So from the practical point of view, to discuss about these points virtually is not possible or beyond my reach. That's, I can say that. Now with this, the last part what Sushila has mentioned is Vyapnyanti abhito deham nabhita prasadaha pratanaha padmini kandavat bisanam yatha jalan. The distribution of the vessels is compared to the roots of the water plants, and like the water plants who have that distributed roots, a few of them going deep and then distributing throughout with the finer branches till it becomes almost invisible. Similar, the vessels are distributed in the body. This is exactly the description. With this, the siravarnavibhakti sharira is over. We'll conclude, and if there are any questions, right, there are not many questions, like, right, we'll conclude today.